Hi again, this is Joya Van Der Laan with Nourish House Calls. One of the things I love about regenerative medicine and regenerative injections specifically is that it fits so well into what I do already as a functional medicine nurse practitioner. Regenerative injections, things like Wharton's jelly or umbilical cord tissue and fluid, really help regenerate and heal tissue. So whether that's arthritis, or it's a tendon or a ligament that's been damaged or disrupted or just degenerated over time, instead of giving cortisone injections, which can help temporarily, but also degrade the tissue further over time, these regenerative injections, Wharton's jelly and amniotic fluid, even PRP and ozone, can really help to rebuild and regenerate that tissue so you don't need any more treatments and you hopefully won't need that surgery on the joint or a replacement or the repair. So I love the regenerative injections because they work so well, and I'm giving the body what it needs to heal itself. One concern that I get from patients most often is, well, if this tissue, if this fluid, if these injections are coming from umbilical cords or amniotic fluid, what about those babies? Yes, the babies were born, they're healthy. These mothers are highly tested and screened to make sure that there is absolutely a healthy mother and the baby went home with the parents. Visits are pretty simple. Usually I like to see the patient first and look over any imaging or order any imaging, MRIs or x-rays if needed, before we really decide truly what's necessary. I don't want to over-treat or under-treat what's going on. After that initial visit, I'll have you come back for the injection visit itself, and we'll do whatever injections were recommended based on your individual situation and your imaging and your symptoms. And then you get to start the healing. So I'll usually follow up, make sure you're doing okay within certainly a few days, but then also I want to check up a few weeks and months later, just make sure everything's healing as it's expected. Sometimes we need another kind of booster dose of the injection depending on what's going on, but very often just the one injection is enough. You can learn more about this on our website, www.nourishhousecalls.com, if you're looking for information. And that's also where you can actually book a free 15-minute discovery call if you have questions or you're just kind of wondering a little bit more about this.